Hello. My
Hello.
name's Adrian. I'll be doing your assessment today.
Hello, Adrian.
Do you know what today is?
Yes, it's 2015, November the 15th.
Perfect, perfect. And you know why you're here?
I do.
Okay, all right, good. So prior to coming in today, I've already assessed his posture when he came in, his appearance, nutritional status versus age, his grooming, eye contact, composure, posture, affect, and I'm going to be assessing his skin throughout the entire procedure, but we'll go ahead and just kind of assess the skin now, looking for texture, temperature, turgor in several different places. So, pinch on you here. Alright, good, good. Alright, so let's start with your head and scalp. So I'm going to go ahead and assess your head, scalp, hair texture, looking for any infestations. Are you having any pain or tenderness in your head?
No, ma'am.
Alright, good, good. I'm looking for, at the facial expression, the level of his ears. Everything looks even. And we're going to go ahead and assess your ears. So, looking at the tragus, auricle, kind of putting some pressure here, looking at the lobes, any pain, tenderness, discharge. Alright, very good. I'm going to go ahead and assess your eyes, and looking at the lids, lashes, your sclera, cornea, conjunctiva. The color looks normal, and there's no discharge. I'm going to assess the ducts, and there's not have any discharge there. I'm looking at your nose, nasal at the bridge of your nose, and your sinuses. Any pain or tenderness in your sinuses?
No, ma'am. No pain.
All right, very good, very good. We're going to go ahead and assess your cranial nerve 8 by doing a whisper test. We'll go back to the ears for a second. So what I'm going to do, I'm going to whisper a word. I want you to tell me what you hear.
Sure.
Okay? All right, so come this side.
You said banana.
Very good.
You said apple.
Very good, very good. All right. And so let's go ahead and just get back to your nose there for a second. I'm going to have you cover up one of your nares and take an inhale. Very good. Cover the other side. All right, very good. Patency is good. Let's go ahead and check your pupils and the pupillary response here. So what I'm going to do is have you look at my finger here, and I'm going to shine a light in your eye. Alright, so the pupils respond to the light. They dilate when the light's gone and constrict when the light is there. So look at my finger, and then look over here at this. So the pupils, for accommodation, they should dilate as he looks farther away and then constrict as he's looking at my finger, which is closer up. Okay. Let's check your extraocular eye muscles, cranial nerves 3, 4, and 6. So to do that, I'm going to have you follow my finger with just your eyes and not your head. Okay? So my fingers. Alright, all the muscles seem to be intact. Let's go ahead and have you check some of the facial nerves in your face here.
Okay.
So I'm going to have you smile. Alright, good. Puff your cheeks for me. Alright, good. And I'm going to have you close your eyes, and I want you to not let me open them. Okay, so close your eyes, don't let me open them. Very good. Nice and strong. Muscle strength seems to be 5 out of 5. The other thing I'm going to have you do is push against my hand. So push your head against my hand. Good. Do the same thing. Very good. Nice and strong. Okay, so let me go ahead and assess your mouth now. So I'm going to get some gloves on here. And light. Alright, so I'm going to have you first stick your tongue out for me and move it side to side. Alright, good. Cranial nerve 10, 9, 10, and 12 seem to be intact. Okay, so stick your tongue out. Alright, right, good. Say ah again.
Ah.
All right, great. And I'm also looking at your teeth, dentition, buccal mucosa, and making sure all the teeth are there. And when you said I noticed that your soft palate did rise and fall, so that's normal.
Good.
All right, let me use this gauze here just to look at your tongue. So stick your tongue out again for me. All right, good. Take a look. All right, I don't see any ulcers, any lumps or tenderness, any pain, no discharge, nothing
Okay.
like that.
Okay.
All right. Let's go ahead. I'm going to check the sensation in your face now. So to do that, I have a cotton ball. First, I want you to just tell me with your eyes closed if this feels the same as I touch it, okay? So does this feel the same as this?
Yes, ma'am.
All right, and does this feel the same as this?
Yes, ma'am.
And this the same as this?
Yes, ma'am.
All right, very good. All right, now you can open your eyes. The next thing I have is a little sharp versus dull to check the sensation in your face as well. So I'll have you close your eyes again. I'm going to touch you. This is going to be sharp.
Okay.
All right, this is going to be dull.
Okay. Good.
Okay, all right. So, do you feel sharp or dull?
That was sharp.
Okay, do you feel sharp or
Dull.
dull? Okay.
That was dull.
Mm-hmm.
That was sharp.
Okay.
That was dull.
Mm-hmm.
That was dull.
Okay, perfect. All right, very good. All right, let's just check the strength in your trapezius here. So lift your shoulders. All right, very good. 5 out of 5. Okay, so we're going to go ahead and assess the anterior chest. All right, get these gloves off here. All right, so anterior chest, I'm going to be just kind of palpating, seeing if there feel any lumps, thrills, pulsations. Don't feel anything. All right, and I'm going to go ahead and percuss here. So I'm going to start above the clavicle, and I'm just going to palpate or percuss here. Okay. Get down there a little bit, and then laterally on the sides, go down a couple. All right, very good, very good. Let me go ahead and check for thoracic expansion. So
Okay.
take a deep breath, and as you do that, I should notice my thumbs kind of separate and then go back together as he exhales. Let me listen to your lungs here. All right, so I'm going to take a listen to your lungs. I want you to take breath in and out through your mouth, but if you feel short of breath at any time or dizzy, make sure you let me know.
Yes, ma'am.
Okay. All right, breath. All right, moving around the sides again, same as with the. All right, and as he's breathing, I'm also have been assessing his work of breathing and, making sure he's not having any kind of difficulty with his breathing. We go ahead and assess your lymph nodes here. So we need to assess, starting here at the top at the preauricular and postauricular. Got the occipital and the tonsillar. We have the deep cervical chain. Very good. And then move your shoulders forward a little bit. There you go. We've got supraclavicular good. And I'm going to have to access in the axillary, your axillary node. So kind of put your hand on your waist. And I'm sorry, these are kind of deep. There's 3 in here that we're assessing. All right, good. And one more time here. All right, very good. All right, I'm going to come around here to your back and assess the posterior. So I'm assessing the skin, looking for any scars, looking for his work of breathing, watching the equilateral, making sure that that's all equal. I'm going to go ahead and assess the thoracic expansion in the back. Sorry, my hands are cold.
Yes, ma'am.
All right, so take a deep breath. And back out again. And again, should see equal as the thumbs separate and then go back together again. So I'm going to go ahead and percuss here the same as before. We're going to start above the scapula and go across here. Starting in every other intercostal space. Stopping right about the thoracic border here and then around laterally. Okay. I'm also going to assess for the CVA for any tenderness, so I'm going to kind of pound on you here.
Okay.
You tell me if you have any pain with that.
No, ma'am, no pain.
Okay, very good. All right, let me listen to your lungs back here again. Nice, easy breaths in and out through your mouth, and just let me know if you start to feel short of breath at all, okay?
Yes, ma'am.
Go over down here, sorry. All right. Let me come back around here. Let me go ahead and assess your heart. And so I'm looking again at the chest here, around the heart, looking for any pulses, any thrills, any listening for anything. I'm going to go ahead and check for the point of maximum impulse here. And once I find it, I'm going to go ahead and stethoscope here, listen to your apical pulse. And while I'm doing that, I'm going to check your radial pulse here. So just rest your arm down there. As I listen, I should hear the beat should coincide at the same time. Alright, so I'm going to go ahead and listen here. We have the aortic, harmonic, tricuspid, and mitral. And I'm hearing regular rhythm, S1, S2. I'm going to go ahead and listen one more time because I have the bell and the diaphragm in the same stethoscope here. Okay. Let me go ahead and assess your peripheral vascular system here. I'm going to look at your skin again, the color, cap refill. This fingers are warm, pink, good cap refill. Kind of put your thumbs together here. I'll check for clubbing. Thumbs are nice and straight there. I'm going to check your brachial pulses here. And radial. Go ahead and check the carotid here. Nice strong pulse. And we've got the dorsalis pedis and posterior tibialis. Alright, and again, feet are a little cold, but toes are pink.
It's cold in here, ma'am.
Checking for edema, starting basically in the foot, ankle, moving up the leg, making sure there's no edema anywhere. Up in the knee here. Alright, very good. No edema seen. Okay. Why don't we go ahead and have you lay down. We'll assess your abdomen here. So what I'm going to do is take a look here. So I'm assessing the abdomen, looking for any kind of thrills, pulsations, any masses or lumps, any scars. Don't see anything there. And go ahead and take a listen first. So a little cold. We're going to listen to your vowel sounds in all the quadrants. And I'll listen until I hear vowel sounds. Good. Alright, good. Vowel sounds in all 4 quadrants. I'm going to go ahead and palpate here, so I'm going to kind of push on your belly. So you tell me if you feel anything tender, any soreness, feel any masses or lumps.
No pain.
Good. Very good. Okay. Also, while we're here, I'm just going to assess the femoral pulse, and then you've got your lymphatic, the inguinal lymphatic system, or lymphatic is down here as well. Okay. So while I have you laying there, I'm going to go ahead and check your lower extremity coordination. So what I'm going to have you do is take your right heel and take it from your left knee down to your left toe. Right, and try not to let it come off of your leg. Perfect. And then we'll have you do the same thing with the other side. All right. Great. Okay. Go ahead and have you set up. Alright, so we've assessed, we're going to go ahead and get to the musculoskeletal system here. So we're looking at strength, looking at muscle tone, again, still looking at skin color, texture, temperature. Going to have you hold on to my hands here. Alright, now squeeze on my fingers. Very good. So it's equal and strong, a 5 out of 5. Going to go ahead and check kind of your joints and muscles. I'm going to put you through some range of motion here.
Okay.
Are you feeling any pain or tenderness in any of these joints here?
No, ma'am, no pain.
Alright, very good. And each of the fingers. Don't notice any problems there. Very good. Go ahead and do the other side here too. Same thing, no pain, no tenderness.
Pain.
Ever had any surgeries or anything on your shoulder?
No, ma'am.
Okay, alright, let's check your lower extremities here. Straighten your knee. Very good. And bend it back. Alright, at the ankle here, back. No pain in the calf, anything like that?
No, ma'am.
Alright. All the extremities moving fine. Straighten that knee. There we go. And again, cap refill's good. Toes are cool but pink. right. So let me go ahead. I'm going to assess your gait. So I'm going to have you
Okay.
stand.
Yep.
And I'm going to have you walk towards the chair that's over there and then
Okay.
turn around and come back towards me. Just walk
Okay.
normal. Very good. All right, come on back. Okay, and I'll have you remain standing. Turn this way for me. Arms at your sides and feet together. All right. Look straight ahead. Close your eyes for me. And just stand there for a few minutes. We're just assessing the Romberg here, making sure that a little bit of a sway is normal. We don't want too much of a sway, checking his equilibrium here. Okay, open your eyes, very good. We're going to check for pronator drift. So what I'm going to have you do again, you're going to have you close your eyes, but first put both arms out in front of you. Good, palms down. All right, close your eyes. And we'll just have you stand there for a minute. So we should note that both hands stay equal. Shouldn't be able to push down. They should come back up. Perfect. Okay, you can open your eyes, put your arms back down. I think that we may have gotten everything.
Yes, ma'am.
Have a seat. Thank you for letting me do the assessment today.
Nice
It was
meeting you.
nice to meet you.